Anatomy of the heart. The heart has 4 valves that ensure blood circulation in the right direction, with no reverse flow. The 2 heart valves are the pulmonary valve and the aortic valve. They are located at the base of the large vessels at the exit of the ventricles. They are tricuspid valves. In other words, they consist of 3 cusps attached on the ring. They separate the right ventricle pulmonary artery from the right ventricle and the aorta from the left ventricle, respectively. The cusps are extremely flexible pouches that fold back against their ring when the ventricles eject blood. Following ejection, the blood column tries to flow backward due to the decrease in pressure and the suction effect created by the ventricle relaxation. This attempt to return causes the cusps to reopen, blocking the blood and making the valve tight. The 2 auriculoventricular valves separate the ventricles from the atria. These valves are situated on the rings and are composed of leaflets, cords, and muscular columns located in the ventricles. On the right side is the tricuspid valve, and on the left side is the mitral valve, which has 2 leaflets. The mitral valve is easily comparable to boat sails. The leaflets are attached to the fibrous ring of the heart skeleton, while the free edges have ropes attached to the ventricle's muscular columns. This configuration allows these valves to be leak-proof, preventing the return of blood to the atria. When the ventricles contract, the pressure generated by the muscle pushes the heart's contents upwards, thus closing the leaflets. The leaflets are held up by the cords, which prevent them from folding back into the atria. Thus, the only way for the blood to exit is through the pulmonary valve on the right and the aortic valve on the left. The heart has its own fascinating electrical system to synchronize its contraction effectively. The conductor of this electrical system is located at the top of the heart in the right atrium. It is a group of cells called the sinoatrial node, which is, in fact, the heart's natural pacemaker. It initiates all heartbeats and determines heart rate. Transmission between the atria and the ventricles is possible only in one place. It is another group of cells, known as an auriculoventricular node, which plays the role of electrical customs officer. It lets electricity out of the atria and determines the maximum heart rate in normal condition. Once electricity has passed through the auriculoventricular node, it is transmitted to the right and left ventricles through 2 branches, 2 specialized electrical wires, in other words, rapid conduction. This electrical transmission that takes place in the ventricles allows the heart to contract from bottom to top and to drive blood toward the pulmonary and aortic valves. To ensure oxygenation of the heart muscle, the heart has 2 coronary arteries, the left and the right. The coronary arteries branch out to surround the heart along its entire outer surface, and their purpose is to vascularize the heart muscle. They originate at the beginning of the aorta. They then divide into multiple branches that will penetrate the muscle in order to irrigate the entire heart. Go to iCardio.ca to discover a wealth of information about heart health.